a mountain that cannot be moved in his name. Jesus, there is no valley that cannot be filled in his name. Jesus.
I have newly found friends. Some of them are battling breast cancer like I have done. So if you are one of them and you're following me on YouTube, please comment in the comment section and just let us know what your experience with chemotherapy was like. For me, day one, within the first, I think about 15 or 30 minutes, there's something I felt that I'm not able to really explain what it was, because it was not loss of taste, it was not metallic tongue like the one in anemia. I just had some funny taste in my mouth. I was not able to eat anything from there. If I was to eat anything, then I'll have to flavor it, maybe with a lot of salt, with a lot of pepper. Sometimes I had to look for spices and sauces just to make it a little bit palatable for me. That night and a few more nights after the first chemotherapy, I had restlessness, I had dizziness, I had headaches, I had abdominal pains. And three days later on, I had pain all over my body. And I remember just calling my nurse, Betty, God bless you. You are such a wonderful person, an amazing person, very caring, very empathetic. And that night, as I had this pain that, just for your understanding, every part of my body was not even aching. This was pain I have never had, including my jaws, including headache, including all joints, including muscles. And because it was a bit late in the night, around 9, I decided to text the nurse. I asked her, Betty, is there anything that you forgot to tell me? And she goes and says that that is filgrastim. Filgrastim is an injection that chemotherapy patients are given, or patients who are having issues with the white blood cells are given, because you know the normal red blood cell lifespan is 120 days, but in chemotherapy it is destroyed when you get that chemo. So what filgrastim does is to just help the cells rebuild in a span of within 3 weeks, so that you are able to get the next chemotherapy. And where this production is done is within the bone marrow. So as the bone marrow is fighting to produce, that is how this pain comes about. And so Betty texts me and tells me, sorry, please use some Betapin. And I had made a mistake of using diclofenac, which I think wasn't, because NSAIDs, diclofenac is an NSAID, meaning that it's an non-steroidal anti-inflammatory agent, which doesn't really help so much, especially this pain. The way I can describe it, if you've ever seen a sickle cell patient or person, that kind of pain is what I really felt, because it was everywhere, especially the joints and the muscles. So with the Betapin, within the subsequent chemotherapy sessions, the Betapin really helped quite a lot. And I'm not making any prescription for anybody, please not. So that when you want to buy any medication, please let the doctor prescribe for you. That was prescribed for me, and I went for it. And sometimes when you have one problem, I think the rest of the problems call themselves for a committee. And you wonder now, which one do I address, which one do I not address? Because I remember that day, even after that prescription, I didn't have any money on me. But thank God for the people that God has brought into my life, that God brought me that time. I'll be talking about it, social capital at some point, because that is how I got to buy those drugs, at least for the pain. So I learned my lesson the hard way. The day I get the filgrastim injection, I'll start taking that medication in the morning, because I have to do it at 3 p.m. and then I'll do it for at least 3 days. I didn't want to be dependent on pain medication, because I didn't want the addiction part of it. And it worked really well for me, because when I went for the surgery, I did not require pethidine or any injection for my pain.